Hello and welcome to the third part of our patient information sessions on inflammatory arthritis. This talk will focus on what you can do to manage your arthritis effectively alongside the treatment you're prescribed by the rheumatology team. Indeed, there's good evidence to show that self-management works to improve outcomes for people with conditions such as rheumatoid arthritis. Self-management takes on many forms, including healthy diet and regular exercise, as well as what you can do at home to manage a flare. We'll talk through these aspects in turn. Before we move on, I'd like to highlight these two large UK-based organisations that represent people with rheumatoid arthritis and other forms of arthritis. They're called Versus Arthritis and NRAS, which stands for National Rheumatoid Arthritis Society. Both have websites which contain a plethora of information about self-management strategies and other forms of support. Rheumatoid arthritis is unpredictable and flares can occur. These may vary in severity from mild flares that can be managed at home with simple painkillers to more severe flares which may warrant a change in your medication or short course of steroids. The symptoms of a flare are often joint pain, swelling and stiffness, but you may also feel fatigued, flu-like or even low in mood. Flares can occur out of the blue or be triggered by things such as infection or a period of stress. If the flare is mild, start by using simple painkillers in the form of paracetamol, codeine, or non-steroidal anti-inflammatories such as ibuprofen. Other things that may be helpful are rest, heat therapy, for example a hot bath, or cold therapy such as application of an ice pack to the affected joints. Do try to maintain gentle movement in a swollen joint, as complete immobility may lead to worsening stiffness. If the flare persists after several days or is severe, it's always best to seek professional help, either from your rheumatology team via the specialist nurses or your GP. If the flares are occurring repeatedly, this may indicate that you may need a change in your DMARD medication. There's no evidence that alternative or complementary therapies have any effect on the disease process in rheumatoid arthritis, but some people find them helpful. It's worth remembering, however, that some alternative remedies have their own side effects and can interact with other medications. It's therefore always helpful to discuss any complementary therapies with the rheumatology team first to ensure that it can be taken alongside your DMARD and other medications. Complementary therapies can take on many forms, and this includes acupuncture, herbal medicine, which is based on the use of medicinal plants, and homeopathy, where extremely diluted medicines are used. If you do decide to use complementary therapies, it's important to check that the therapist is qualified and insured. As you're probably aware, carrying too much extra weight puts excess strain on our joints and can also increase levels of inflammation in the body. In order to achieve a healthy weight, it's therefore very important to eat a healthy and balanced diet, such as the Mediterranean diet. The Mediterranean way of eating is based on daily intakes of fresh fruit and vegetables, nuts, beans and pulses, olive oil, whole grain cereals, and regular oily fish and poultry consumption. It also entails limiting red meat, sweets and biscuits, and drinking alcohol in moderation. Research suggests that consumption of a Mediterranean diet reduces the incidence of clinical symptoms related to the immune system and chronic inflammation. Antioxidants and the vitamins and minerals found in fruit and vegetable also support the immune system. In general, your diet will benefit from eating lots of oily fish, which is high in omega-3 fatty acid and may have anti-inflammatory properties. For snacks, eat unroasted and unsalted nuts and a wide range of fruit and vegetables, which contain antioxidants. Avoid too much white food, such as sugar and white bread, and swap this for whole grain alternatives. Avoid too much red meat and also limit foods high in saturated fat, such as cream and butter. Exercise is important for people with arthritis, as not only will it improve your general health and reduce the risk of cardiovascular disease, but it can also improve muscle strength and function. It will also help to counter a condition called rheumatoid cachexia, in which muscle wasting can occur as a consequence of chronic inflammation and lack of physical activity. I'd just also like to reassure you that there's no evidence that exercising will make your arthritis worse. Conversely, it plays an important role in improving joint flexibility, muscle strength and balance. This slide summarises the general physical activity guidelines for adults. These recommend a minimum of 150 minutes of moderate intensity exercise over the course of a week, or 75 minutes of vigorous intensity exercise across the week. On at least 2 days per week, we should do muscle strengthening activity. So what do we mean by moderate intensity? This describes activities that cause us to breathe harder, but where we can still hold a conversation, such as brisk walking or cycling. Vigorous activities will cause us to breathe much harder and find it difficult to speak, such as running or swimming. Activities that strengthen muscles include exercising with weights or carrying heavy objects. In summary, all people with rheumatoid arthritis should be active, and there's good evidence that this will improve quality of life without causing joint damage. However, there are certain precautions with regard to exercise and rheumatoid arthritis. Physical activity should be introduced slowly and built up more gradually than normal. Exercise should be avoided in the day or so after steroid injections. And finally, high impact activities or contact sports are not recommended. Work has many benefits, including obvious financial ones, but also to our general well-being and self-esteem. The Equality Act, introduced in 2010, legally protects people from discrimination in the workplace and in wider society. This includes people with disabilities, for example, those arriving from rheumatoid arthritis. The employer is required by law to make adjustments within the workplace to help support a person with disability, such as changes to working hours or duties or the provision of special equipment. In order to facilitate setting up the support you need at work, you can ask for a workplace assessment, either from occupational health or the HR department of the company, or alternatively from an occupational therapist or physiotherapist. There is also the Access to Work programme available through the Department of Health, which can offer practical advice and help if you have a disability. Finally, just a mention about fit notes. These are a statement of fitness and health, usually provided by your GP or hospital doctor. They're used if you're on sick leave for over 7 days and advise whether you'll require any additional support or adjustments in order to return to work sooner. Their purpose is to prevent long absences from work and the loss of confidence and skills that this might result in. I'd like to finish this talk by mentioning mental health. Depression in rheumatoid arthritis is more common than in the general population, but it's under-recognised and underdiagnosed. If you feel low or in mood or depressed, please talk to your healthcare team, as you may be offered referral to various forms of therapy, such as CBT or psychotherapy. Other resources for emotional support include patient organisations such as NRAS. In summary, we've touched upon a broad range of topics relevant to self-management of your arthritis, including how to manage a flare, diet and exercise, as well as accessing support at work and addressing mental health issues. Thank you for your attention.